You know, you mentioned thermographic scan. What is that, and what does that tell you?
It's a technology that I've incorporated into my office last year. It's a computerized scan where it's actually an infrared sensors, and we measure up the spine from the very lowest part of the sacrum all the way up to the C1, the atlas, and it measures heat differences on each side. And what that does then is interpret how the autonomic nervous system is functioning, which is the part of the nervous system that runs your body through the subconscious, and tells us how emotional stresses have affected the internal organs and which internal organs might be most affected.
And then with that knowledge, you can recommend that people do things and help them yourself?
Well, what I do is I take that information, as well as when I'm doing a new patient exam, I'll use a static EMG, which will actually use the same equipment but measuring muscle activity, and I can look at where the muscles are pulling unevenly in the spine, causing that spinal distortion. And I use that primarily as an adjunct to my physical exam, because no matter how good a computer is, it's not as good as my hands.
Yeah. Oh, yeah. Yeah.
You know, my own intuition, but it's a good visual for a patient, and it's a great tool for reevaluations, because you can rescan and say, wow, look at the changes. In fact, last week, a woman came in for her re-exam, and she was all flared up from some emotional stress, and it was so different than her first one. I said, well, let's treat you. Found this big thing, cleared it, rescanned it, which I don't often do, but just I wanted to see it. We rescanned it, it was clear.
Wow.
That quick.
Do you recommend that people, so say you have a misalignment or something, and you can manipulate that a little bit. Do you have people do exercise or some kind of, what I mentioned it before, is like reprogram or
Well, there are certain things that we do have patients do. There are certain exercises, we call it a mortar march, which is actually standing with a cross crawl motion, turning the head, holding the breath, closing the eyes, thinking an affirmation, and it helps to reset. There's different sort of breathing patterns that I'll recommend to patients. I'll have them do affirmations, and also recommend them do whatever exercises they like. It could be Pilates, it could be Bikram yoga, it could be that they love Tai Chi, it could be mountain biking, it could be something. Do something.
Yeah.
You know.
Okay, and just to sort of bring this back around, you'll be discussing all these things at the Community Appreciation Day.
Absolutely.
And I see in your flyer here that the benefits, the proceeds, are going to go to the Hospitality House, and that's let's see, and I can't remember where it is, but. That's Utah Phillips's idea.
Yeah, exactly. I heard that on the radio back, I guess it was in the fall. And I really liked the idea. I'm originally from Venice, Santa Monica area, and in Santa Monica the homeless situation is pretty severe.
Out of hand.
Just, I guess they said there's like 250 homeless, probably more in this area. There was probably 250 homeless on the walk from my office on Lincoln and Wilshire to the beach, but here, it's much more severe because of the winter time. And what we also know is, many times homeless people aren't down and out, necessarily drug addicts, alcoholics. Some of these people are just marginal. They just can't they're making minimum wage, they had an illness, they can't save up enough for rent, they've got children, there's been a divorce, they're living out of their cars, whatever. And I just felt it was a way I just really got behind that. And so we're doing a raffle for some free treatments, from free evaluations, some supplements and books, different things. And the proceeds will be going to the Hospitality House.
What kind of books? Dynamic Health book by Dr. Mortar?
Yes.
That's your teacher?
That's my mentor, that's my teacher.
Boy, how fortunate is that to get the source?
Oh, yeah, and I've been fortunate because I met him early on when he was developing this work, and have had a lot of time to be personally with him. In fact, I was with him in Las Vegas for 4 days at a convention, and a lot of the people coming in that we're teaching, they're learning from us, and they didn't have the opportunity to learn from him. So I do feel very fortunate.
This is great.
And I've had so many good teachers in my life besides Dr. Mortar, very spiritual teachers too, and all of that has helped a great deal.
Your talk is called Living Vibrantly.
Yes.
So can we tell the folks just a couple of things, like what Living Vibrantly might entail? Well,
again, the understanding is, an understanding we were talking about earlier about quantum physics. Everything has a certain vibratory range. Everything in life is vibration. Even a best way to understand that is everything's made out of the same stuff. There's no new stuff. There's no different stuff.
It's all atoms.
It's like water is H2O. It's the same molecule, whether it's in water as a fluid, whether it's a solid as ice, or as a gas as steam. It's just vibrating at different frequencies. So that's actually what's happening in life. There is a variety of frequencies that we need for good health. And so as we start to look at our choices and our lifestyles and our choices in what we're doing, what we're watching, what we're reading, what we're eating, we start, is this the highest vibration? Basically, there are two basic vibrations. There's the vibration of love or the vibration of fear. What do we want to resonate? Fear is going to create a lot of separation and breakdown in our bodies. Love is what Dr. Mortar calls type O energy. It's universal.
What about, all right, say there's somebody who is, take a 3-year-old who's been taught that anger, which to me is just another facet of fear, really, is, so someone's been taught since they were a child, oh, anger is the way to get all the things you want. You know, if you need space, just get angry. If you want something done for you, get angry. If you do this. So here this 3-year-old grows up and now they're in their 40s or whatever, and that's their basic thing. I mean, they understand the concept of love. They may even feel like they love people and that they're working toward that. How do you, can you talk a little bit about changing that mindset?
Well, you know, right off, you talk about someone who's in their 40s now that have been running anger for most of their life. They've probably got some health conditions.
Sure.
At this point, they've probably had a gallbladder taken out. They might have had a heart attack already. They've got arthritis. They've got bad digestion. On and on and on and on. And so right off, you start to make the correlation between their emotional states and their physiology. And that starts to wake people up. They go, wait, you mean this is affecting my body and my health? And you start to ask yourself the question, is it worth it? There was a book that I loved the title of, came out, about 20 years ago. It said, You Can't Afford the Luxury of a Negative Thought. I just love that title because it's a luxury. How do you want to spend your energy?
Well, you also, and another thing is you want people to recognize that their mind isn't separate from their body. Everything's working together. There's a great book by a guy named Ken Dykewald, that's probably 20 years old too, called Body Mind, which shows some of the, the way the connection works. And as you just mentioned, if you're going to be running some emotional thing for a long period of time, it's going to affect your organs. It's going to affect your body in a variety of ways.
And these are all part of the education we do. And the book Dynamic Health is an amazing book that Dr. Mortar put together that he just correlated all this information about how the mind affects the body in a very easy to read manner.
These books will be available at your event?
They'll be available, and also we're raffling off quite a few.
Excellent. In your notes here, an alkaline diet.
Oh, we started talking about diet, and we kind of moved off that. Yeah. The core of what we teach nutritionally is that our bodies are alkaline by design, but acid by function. It's constantly producing acids as a byproduct of metabolism, which normally you can get rid of through your breath. Yeah. You produce carbon dioxide and you breathe it out in water. Your dietary choices can also create acids. So most of the standard American diets are way too acid, meaning they're too high in meats and dairy and too high in grains and eggs and those type of foods.
So what would you substitute there?
Well, you're not necessarily
You're killing me here. I've already given up just about everything.
Well, you don't have to give it up. It's about the ratio.
Ah.
The ideal diet would be, the core would be around your vegetables and fruits. And then those acid foods, which are your protein foods, which are building blocks, you want to have smaller amounts. So an ideal diet to maintain the proper pH of the body is about 70% to 75% alkaline foods, which are your fruits and vegetables, 25 to 30% of your acid foods. So it's not that you can't have a hamburger or you can't have a soy burger or whatever it is.
Yeah.
Whatever you choose, you just have to look at the ratios, because the underlying cause of all chronic conditions is an overacid condition in the body. The cause of that acid condition can be, emotional, physical, or mental or chemical.
Yeah.
But the key is it's going to be acid. Acids burn; they create inflammation.
And there you go.
And there you go.
Let me ask you this. So I just recently started. I'm not going to try and get you to give me free advice, but when you're doing an exercise program, I've read a variety of different things about what to eat when. And the one that seems to make the most sense to me, although I'd love to hear from a professional, eat the carbs before you work out and then eat protein afterwards. So does that make sense?
That makes a lot of sense, because the carbs are your energy foods. They're fuel. Whereas your protein foods are your rebuilding. It actually takes more energy to convert protein into calories than you get from it, because it creates this whole conversion. So your carbohydrates are the most important, though we're starting to learn more and more that the fats are probably even more important. Good quality fats in your diet are so key because the cell walls, each cell, the membrane is fats, it's a lipid. And we need good quality.
No, I didn't know that.
We need good quality fats to be able to build that cell wall.
Well, what about the argument about building, fat cells when you're younger? Then those are going to be there forever, and even if you lose weight and get yourself into shape, those fat cells are always sitting there waiting to get fat again.
Well, I'm not so sure that that's absolutely true. I think there's some validity in that, but we do set up trends when we're young that we follow through, and they can be changed.
Just like all these fancy diet books that come out. I mean, every few months there's a new diet book that tells you something different.
Always.
Although, I like that idea of the protein and carbo intake. And it makes sense. Another thing about eating carbs before you exercise is you're setting your body up to assimilate the carbohydrate or the fats or whatever it is. So if you go ahead and exercise right after that, you're going to be eating up whatever's left. Once you've eaten the food and assimilated that, then the fats that are still in your system stored in there will get burned next.
Yeah, there's a saying that in exercise physiology that fat burns in a carbohydrate flame.